Hi, my name is Josephine Benavidez, registered nurse, and I am presenting my capstone and 5-year plan for Lamar University Nurse 4580 Synthesis of Professional Nursing course. I received my license of vocational nursing from San Jacinto College in 2001, where I began my nursing career in adult med-surg. In 2004, I received my associate's degree in nursing from San Jacinto College and began my career as a pediatric nurse for Texas Children's Hospital. I am currently enrolled in the Baccalaureate of Nursing program at Lamar University and plan on graduating May 2019. I am proud to acknowledge that I was inducted into the Sigma Theta Tau International Honor Society of Nursing in November 2018. The first student learning outcome we will discuss is Humanity and Society Construct. This outcome practices safe and effective holistic patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This was met in Nurse 4316 Activity 1, Healthy People 2020, where I discussed increasing the proportion of infants who are put to sleep on their backs. In this research project, I discussed benefits and safety of placing infants on their backs to sleep. Preventing sudden infant death syndrome is one major reason to avoid placing infants on their stomachs to sleep. Education is the key in our society of young or first-time parents to promote safety and well-being of infants. This outcome was also met in Nurse 4550 course with the Global Health PowerPoint presentation, the International Childbirth Education Association, in which I discussed opportunities to become certified in childbirth education. This association has a vision to create a nurtured world through professionals in family-centered maternity and newborn care. I felt this outcome was met at 95%. The next outcome, Lifespan Health Continuum, that supports patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death and dignity. I feel this outcome was met in Nurse 4620 with my practicum reflection 1, 2, and 3 on non-Hodgkin's B-cell lymphoma, primary central nervous system. In this reflection project, I interviewed a 70-year-old Hispanic male with non-Hodgkin's B-cell lymphoma, primary central nervous system that underwent surgical removal of tumor to his brain and received intrathecal chemotherapy and radiation. Because of these treatments, he began to suffer memory loss. The plan of care was created around memory loss and evaluated by goals set and met. I also met this outcome in Nurse 4321 Focused Insight essay questions, in which nursing theories were identified and discussion on how these theories promoted ways of approaching the patient and helping them through their care. I believe this outcome was met at 94%. Outcome number 3, Lifespan Health Continuum, evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This outcome was met in course 4620 with community-based service learning PowerPoint presentation on peripartum cardiomyopathy. In this presentation, a 54-year-old African-American female was interviewed on her diagnosis of peripartum cardiomyopathy 2 weeks after delivery of her last child at the age of 34. She had to have a defibrillator placed that malfunctioned, leading to a placement of a left ventricular assistive device, and she was waiting to be placed on a heart transplant list. Community resources and support groups were also discussed. I believe this outcome was also met in Nursing Course 4520 with the assignment Special at-risk populations and settings. Scenarios were discussed about special populations and settings. Health risks were identified along with methods, approaches, and tools to help educate these populations. I feel that this outcome was met at 97%. Outcome number 4, Evidence-based practice and clinical reasoning construct, synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. This outcome was met in Nursing Course 4321 with research paper, Differentiated Essential Competencies of Nursing. This paper discussed proper uses of differentiated essential competencies in a case scenario involving a patient fall. This outcome was also met in Nursing Course 4316 in Assignment 2, Nursing Process Care Plan. This care plan discussed disease and disease processes, assessment, planning of goals, methods of evaluation, interventions, and identified nursing theory and how it guided the nursing process. I feel this outcome was met at 98%. Outcome number 5, patient and client-centered care employs safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. This outcome was met in Nursing Course 4580 with Practicum Discussion Number 1 regarding baby William. In this discussion, I discussed safe practices and collaboration of care of a 3-week-old baby who was overdosed with IV potassium. This outcome was also met in Nursing Course 4580 with discussion number 2 regarding Lewis Blackman. This case scenario involved the unexpected death of a 15-year-old following routine surgery and the patient-family collaboration with medical staff. I feel the goal was met by 98%. Outcome number 6, professional roles differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients, clients, and members of the interprofessional and intraprofessional healthcare team. This outcome was met in Nursing Course 4550 with the Practicum Discussion Number 3, Healthcare Leadership Roles. I discuss how nurses play a key role in patient safety and when nurses are faced with a heavy patient load, how they can voice their concerns by submitting a request for peer review under Safe Harbor law. This outcome was also met in Nursing Course 4321 with my philosophy paper on my personal philosophy of nursing practice, in which I discussed the 4 components of nursing's meta-paradigms, compared my views with those of nursing theorists Ellen Erickson and Patricia Benner. I feel the outcome was met at 98%. Outcome number 7, professional roles, demonstrates professional integrity, effective communication, active inquiry, and service to the community. This outcome was met in Nursing Course 4540 with my project video on hurricane preparedness in the homeless population. In this video, I discuss how to prepare for a hurricane to a group of homeless people. This outcome was also met in Nursing Course 4550 with my clinical application paper on improving communication. In this paper, I discuss how lack of communication amongst caregivers and their patients could be harmful and a potential problem to a patient's safety, and ways on improving that communication. And again in the same course with the assignment Effective Leadership and Qualities paper, where I discuss effective leader characteristics and performed a self-analysis. I believe this outcome was met at a 98%. My 5-year plan. I plan to continue my career with Texas Children's in my current pediatric office as a telephone triage nurse. My goal is to get certified in nurse case management so that I can transfer to the hospital setting and continue my nursing career. Thank you.